what's menopause got to do with me? What's it got to do with emergency?
Well, if I keep my women well at midlife, they are not going to be presenting to you as much with cardiovascular disease, with osteoporosis and fracture, and the sequelae of all of those problems.
Hi, it's Jonathan.
Hello, it's Sonia.
It's time for Cut to the Case. And we're on location. We've just come back from Kuala Lumpur, where we've been to the Asia Pacific Menopause Federation scientific meeting. And welcome to Sonia, endocrinologist, menopause expert, past president of the Australasian Menopause Association and keynote speaker.
Thanks for having me.
So what did we learn at this conference? Tell us, what was it all about, Sonia?
Well, we looked at new and emerging treatments. We looked at vasomotor symptoms, which we think are actually flushes and sweats. We looked at them in the context of they're happening at menopause, but they're actually ringing alarm bells because they're linked in with other processes such as cardiovascular disease.
Oh, okay. Yeah, that's something I didn't realise. So you're saying if your flushes are coming on, you're more at risk for cardiovascular disease. Yeah. Okay. So menopause. Tell me what percentage of women does it affect?
Well, we're all going to undergo menopause if we get old enough. The average the median is 51 to 52 in Australia. The usual age is 45 to 55 years.
And does everyone get symptoms?
20% no symptoms. 20% severe symptoms. They can drench a beach towel overnight several times. Their mood might be terribly affected. They may not sleep, or they may wake, sleep. It can be a real nightmare for some women.
So they're the vasomotor symptoms, aren't they?
Yeah, but it's not all about vasomotor symptoms. Sleep disturbance, mood disturbance, genitourinary symptoms. People hurt, aches and pains just generally. Some women just feel tired, and really if they're not sleeping well and they're feeling tired and their quality of life is eroded, they're more likely to have accidents and again present to emergency.
So they're the symptoms. Okay, symptoms of menopause. What about investigations? Are there things? I mean, at the conference there wasn't a lot of investigations. Should we be doing investigations when someone's got those symptoms, Sonia?
Well, I just really want to do a tune-up and just make sure their cholesterol is okay, their diabetes, because remember they're presenting usually at midlife. Make sure their thyroid's fine. Some women I will do a bone density as well, because again they are higher risk of osteopenia and osteoporosis and fracture as they get beyond menopause. So it's looking after the woman at menopause, but then thinking of her life after that.
What about hormone levels? Do you need to check the hormone levels?
If it's a usual story in a typically aged woman, we do not need to do hormone levels. It's only when it's a funny story or if the woman is 40 or under and that's a premature menopause, and they are at really high risk of osteoporosis, cognitive decline, and cardiovascular disease. So we really want to pick up those ladies.
Okay. So we've done symptoms, we've done investigations, and finally, what about treatments? There are a lot of treatments on offer. Just take us through what we learnt at the conference. What's new, Sonia? What's hot?
Well, there's a new emerging number of treatments. One of them is called fezolinetant, which the brand name is Veoza. But this is targeting vasomotor symptoms in a very different way by targeting the hypothalamus, which of course is the temperature regulation centre. So it's a non-hormonal way of targeting symptoms, which is very novel. We haven't had really good treatments, and typically hormone therapy or other medications have been used for this.
So that's new. So that's a non-hormone related treatment for the hot flushes and the vasomotor symptoms. Any other new drugs out there we should know about?
Well, there's lots of natural treatments that women may be taking, may be putting themselves at risk with, and they actually don't work. So it's good to know that. And they may present to emergency with, side effects of those medications, and particularly drug interactions and supplement medications. There was a big push on lifestyle as well. So sleeping at least 7 hours a night, doing some regular weight-bearing exercise, trying to do 150 minutes a week, which is 21 and a half minutes per day. Those things are really thought to be really important, especially at midlife and beyond. Make quality of life better, help our heart, help our brains, help our bones. So there was a real push on lifestyle.
So lifestyle, new treatment for vasomotor symptoms. Anything for the osteoporosis? Any new drugs out there?
Well, there is an emerging group again. It's a monoclonal antibody to a bone protein called sclerostin, and that's very exciting. It's called romosozumab.
Romosozumab.
Brand name
Sure.
is Evenity. It's
Okay.
a series of 2 injections per month for 12 months. You need to have very severe osteoporosis and fracture on another agent to be eligible. But these agents are really exciting because they not only grow bone, but they stop the loss of bone, and that's very novel. So
Stop the fractures.
yeah, we'll look out for those because they may be presenting to emergency again with issues related to these new drugs. So just be aware that those medications are out there.
Sounds good. So we covered a lot of ground. There's lots on history, lots on the investigations, and a whole lot of new treatments that we saw at the conference. So thanks, and see you next time. Bye from Kuala Lumpur.